Welcome to our session regarding barcode scanning in the OR at the Tweesteden ziekenhuis, or hospital. At first, we'd like to thank GS1 the Netherlands for inviting us. It's a pleasure. Let me introduce ourselves. Standing next to me is Jeroen van Winden. He's supply chain coordinator at the Tweesteden Hospital. And I'm Roland van Loos, and I'm a business manager OR at 2 locations of the 3-location-based hospital. Our hospital is a large hospital, representing near 1,000 beds, 24 ORs, and more than 5,000 employees in the nice county of Brabant, the Netherlands. You should visit there as well. It's a real company. Like Timothy Young from Hong Kong mentioned earlier today, we struggled with pretty much the same issues, but in a different league of the hospital care. The OR is a high-value business, high turnover of patients and materials, but also high stock values. You just simply cannot afford to have something, to not have something, sorry. Unfortunately, the total loss a year is much higher than it should be, and there's no sufficient oversight, and you need a lot of space, as mentioned by Mr. Young. Advantage is the safe feeling you get out of it. Because of budget cutbacks and the obligation of registering what we use in patient care, because of healthcare inspection guidelines, sorry, I'm a bit stressed now. Maybe I should use you. We were in need of a suitable solution without creating even more work for our staff. Looking for possibilities, we've discovered that a connection of order management, settling the bill to the surgical specialties and registering what we use in patient care should be easily combined in one barcode system. But our executive board wasn't convinced at once. A reason for us to prove our theory and cut the project up in 2 phases. First, settling the bill to the surgical specialties so they feel equally responsible for the process and for the costs made. Scanning custom-made, home-printed GS1 compliant barcodes and manual input of lot numbers in the OR. Building an automated system and ordering process while scanned for use. With this, we created a major cost benefit, lower stock levels and many more. Jeroen will tell you more about that later. For that moment, most important, confidence that our solution worked, really worked. And, therefore, a final go from our executive board to move on. In phase 2, we redefined the project and made a switch to supplier-provided GS1 barcodes and automated input of lot numbers in the OR. It's up and running, but only in the OR. Our ultimate goal is to use the system within the whole hospital. And of course, we had some risks. Major risks. Overflow of administrative tasks for our OR nurses, doing the same over and over and over again. Changing the mindset for logistics and staff. No need to have a lot of stock. Let go of the manual input. And trusting an automated system. And as you can imagine, that's quite scary. And the risk of mismatching automated stock levels and actual stock levels. We will pass on to Jeroen. He will tell you about the benefits of our homemade system.
So we have 4 major benefits from the project after phase 2. We can perform a digital recall. We have quite a significant stock reduction, quite a significant cost reduction, and a very optimized logistic process. First of all, a digital recall. A lot of data. What you see here is a query which was made within probably 30 seconds. And from left to right, you can see the date of surgery, the patient number, the kind of surgery, the category of the product, which in this case is a hip prosthesis, the lot number we queried, description of the article and the number of items implanted. As I said, this was done in 30 seconds probably. If we were to do this recall 3 years ago, we probably would have taken one person at least a day to go through all the paperwork and coming up with the same result. So that's a huge benefit for us. And also, looking at patient safety, this is a very big advantage of having a scanned solution within the OR. A second large benefit, the stock reduction. You see here a graph for one specific group of articles, in this case being orthopedic anchors. What you see here, after the start of the project in 2013, the stock declined rapidly and stabilizing at around, what you can see here, 34,000 euro after some time. This means basically that the level it's on right now, we can maintain that, and that's the level we need so we can cope with peaks in usage, but also back orders with the supplier, without losing the feeling that we are safe, and we can always, without stress, use the products at the OR at the moment it's needed. This is just one group of articles. In general, we have about a 10% safe in stock, which for our situation adds up to about 100,000 euro, a little bit more than that. So cost reduction. This is a graph of the trend of the express delivery costs throughout the last couple of years. As you can see, we lowered that from 3,000 euro to an expected 700 this year. Not a very high amount. It's not a very large cost saving, but for us this is a very important indicator. Not for the cost, but for the level of safety that our surgeons and our OR nurses feel surrounding the processes or the surgeries they have to do. Basically, you don't want a surgeon or an OR nurse having to stress for products, looking for products that they need further on in the day. So less express delivery for us also means a quieter OR and having people doing what they are doing best, surgeons and OR nurses, which is of course perform surgery. So this is the high-level process before we started this project. I will not talk you through all the steps, but it's as you can see, it's quite a lot of steps, quite a lot of manual steps in there. One automated step. You can imagine with a lot of steps and also a lot of manual steps in this process, a lot of risk of errors, a lot of risk of delays, all kinds of things messing up the process and making sure you're getting redelivered quickly and you reduce the risk of going without products. It's a lot simpler. We have a lot more automated steps. We have cut out a lot of manual steps. What it basically means, without the figures, what it basically means is if an OR nurse has an implant or a disposable, she scans it. There's no manual work whatsoever up until the moment that the order is being sent out to our supplier. This means a lot more safety, and it also gives you the tools you need to perform the stock reduction, as I mentioned earlier. You can imagine with an optimized logistic process that you are getting redelivered more quickly. This is a graph from the last couple of years with a percentage of orders being redelivered to us or being delivered to us within 24 hours. In the old days, let me put it like that, we had a lot of delays, we had a lot of people forgetting things, making false entries within the system. And now with an optimized system, we have seen that the number of 24-hour delivery has risen from about 40% to about 70% in the current situation, which again adds to the stock reduction. It makes more peace and quiet surrounding ORs, and it's a very, very big advantage. So of course we're here at the invitation of GS1. So how do we, what do we do with GS1 in a day-to-day business? This is, it's another barcode, quite an ugly one, I think. We don't want that anymore. We want to have this on all our products. We are we are very fortunate to say that for the larger part of our suppliers within our hospital, I think we have just one major supplier that hasn't a GS1 barcode on them yet. We're in a lucky position that most of them do. And why do we want to have a standardized barcode on our products? Basically, we have OR nurses, we have people in the logistics who are not used to scanning. They were not trained to do scanning in the education to becoming an OR nurse. There's no section how to scan a GS1 barcode or what is an HIBC barcode. So any standardization for them in usage is very important. That's for the current situation. In the near future, of course, you can imagine that you want to expand the supply chain with standardization, and of course for that you need just one standard that everybody uses. So how do we strive, as we say it, towards 100% GS1 barcodes within our OR? First of all, we invite the suppliers that do not have a GS1 barcode on their products as of now, and try to explain them basically what I just did to you, explain to them why we want to have the GS1 barcodes on there, why the urgency, and how we can help them, maybe putting pressure to their IT department internally by putting on a GS1 barcode. Of course, there are still some suppliers that do not have any barcode at all on their products. We put an own GS1 barcode, as René, a similar barcode as René just explained. We put that on the product so our OR nurses can scan the product right away. And third, last but not least, we have a discussion with our purchasing department where we state from the OR, Roland stated that we do not want to have any new products coming into to our OR that do not have a GS1 barcode on them. I should mention we strive towards this because in practice, of course, it's very difficult to uphold this, but it's also the starting point for each new introduction of products within the OR. So we currently have quite a good system. We're very proud of it. It works very good, but we're not finished, of course. We are in the middle of a merger. That means that we go from 2 to 3 locations. In the third location, we want to roll out the same process as we have in place in the current situation. That's due in 2016. The second one, the lot number track and trace, lot and serial number actually. In the current situation, we just log that at the moment that it's being entered or used at the patient. We want to expand that. Basically, we want to start scanning the moment the products come in at the unloading dock and end it at the moment we use it at the patient. And that's also due for 2016. And last, something I expect personally quite a lot from. I called it in the presentation shifting the push-pull point, which is a bit of a logistical term. What it basically means is that in the current situation, we use, we scan, we resupply. We let the supplier deliver to us. Where we want to go is all this data concerning planned ORs in the near future or further future. We have the data which is normally used at this OR, combine that, and start up the supply chain basically when we plan an OR rather than at the moment we actually do the OR. This would mean, in our point of view, this would mean a lot of lower stock and a stock that's better suited for the ORs that are ahead of us. Which also means that with lower stock you can have a better availability and a less risk of falling with our products. So what do we want the hospitals being here? What do we want to give them as a take-home message? Don't hesitate, just do it. As Roland explained, we started small with the first phase. I can convince anybody if you start scanning and you're scanning for a week and you have an optimized logistic process, you cannot imagine ever going back to paper. I mean, this is the future, and I think everybody should just scan. And if it's in a small place, you will expand it by itself. Basically, it will sell itself. So if you have any more questions regarding our presentation, or maybe you want to come over to Brabant and have a look at our new process, please feel free to contact us. And on behalf of myself and Roland, I would like to thank you for your attention.